Welcome to Advancing Health. June 8 through 12 is Community Health Improvement Week, a perfect time to recognize Denver Health's award winning approach to the stubborn and difficult problem of homelessness. Hello, friends. I'm Tom Hedderly, Senior Communications Specialist with the American Hospital Association. Homelessness is complicated by the reality that many unhoused people also deal with complex medical, behavioral health, and social challenges. And as most will attest, it's all too easy to fall through the cracks. That's why it's a pleasure today to welcome someone who is driving real progress on a problem that defies easy solutions. Dr. Stella is the co-leader of Denver Health's Housing Outreach Partnerships and Engagement, or HOPE program. Dr. Stella, thank you for joining me on Advancing Health today.
Nice to be here.
First off, let me offer my congratulations on the HOPE program's recognition last month with the American Hospital Association's 2026 Dick Davidson Nova Award, which is our award that honors outstanding collaboration by hospitals and health systems working to build healthier communities. It's quite an honor, so hats off to you.
Thank you very much. It was a real honor to be in Dallas to receive the award.
Why don't we start at the beginning and please share with our listeners what HOPE is designed to do and the role that community partnerships play in helping Denver residents access the services they need.
Well, I love that you mentioned seeing folks fall through the cracks. So I'm a hospitalist. I'm an internal medicine trained hospitalist physician. So I've worked at Denver Health for nearly the last 2 decades. And a lot of what I do is, and what we do at Denver Health is catching people that are falling through the cracks, which sometimes are more like gaping holes in our systems. The HOPE program is really unique because it is an interdisciplinary team that lives at the intersection of the hospital system and the Metro Denver homelessness response system. And so I think sometimes what we see is, although hospitals like Denver Health are disproportionately caring for folks that are experiencing homelessness and other really significant social needs, that we're often separate from the response systems. And so a lot of what I've been doing, so I still practice hospital medicine with part of my time, but a big part of what I've spent the last decade doing is really building partnerships beyond the hospital walls to improve care for some of our most vulnerable and at-risk folks experiencing homelessness at Denver Health. About 1 in 5 of the patients that I treat in the hospital is experiencing literal homelessness. So this is a significant challenge. We know that our folks experiencing homelessness have longer length of stay, really complicated discharge plans sometimes. And so working with a range of different partners is really important to improve the quality of care that we provide, as well as our financial bottom line. Because we know that if you don't have a safe place to go, you're likely to be in a hospital bed far longer sometimes than is needed. So having trusted partners on the other side of that transition is critical.
And what kind of options has that created working with these partnerships? If a patient comes into the hospital for a medical condition or reason, but you realize they're going to need a little bit more than that, a stable housing situation, a roof over their head that they can count on. What are some of the options that you can provide, and are they temporary or are they try to be permanent?
Yeah, great question. So we do have a partnership with the Colorado Coalition for the Homeless. They are a long existing provider of integrated housing and healthcare, and they operate a large recuperative care center in Denver. And so one of the ways that we partner is by investing in our partners, and so we help fund a portion of recuperative care beds in the John Parvinsky Stout Street Recuperative Care Center to use as a discharge destination for many of our folks experiencing homelessness that have really complex medical needs. So things like wounds or needing IV antibiotics for a prolonged period of time, broken bones where people are unable to bear weight, and they really need a safe place to rest and recuperate from following that hospital stay. So that's a great partnership for us, and that has helped us to reduce our length of stay. That is not housing, and so we still need to think about what is the next step for that patient. But it's a really great place to get medical care, to be able to heal, and then get connected with housing and other supports that can help someone take the next step. We also have had operated a, transitional housing program at 655 Broadway. That's a partnership with the Denver Housing Authority, and that is specifically for elderly, and/or, disabled patients who are experiencing homelessness, again, to transition them, out of the hospital, provide wraparound supports, and then try to get them connected with longer term housing in the community. And then we just work really closely with our city partners, who can provide non-congregate shelter, like motel rooms, with some wraparound case management. We partner on the Denver Housing to Health program, which is a permanent supportive housing program, that provides, not only do we have a very responsive, partners on the end of that transition and a warm handoff to those partners during a hospital stay, but folks also, are provided with a housing voucher and get connected with long-term permanent supportive housing. Really, actually, how we learn to do a lot of the way that we work and we make connections, and have these strategic partnerships. We learned how to do that through our Denver Housing to Health program. It's sort of proof of concept that when we have the right data to identify folks and outreach them, we have the right team on the ground outreach them, and we have partnerships and resources on the back end, it is possible for someone to go from hospital into housing. And I think that's a great model for hospitals to think about in terms of, what we can do to meaningfully partner, to address homelessness.
That's wonderful, inspiring work. I'm really, really impressed. I would like to pull on that thread a little bit. You mentioned there is an issue of identification. Who needs these services? I read an article that you wrote that was published last October. I guess it was theconversation.com was the website about your frontline experiences as a care provider. And you made some excellent points. You noted that Denver, and I would say probably most cities, tend to undercount the homeless. And I wanted to share one quote from that article that really struck me. You said, others are hard to spot, staying out of sight on couches or in creek beds or hiding in plain sight while they serve our food and fix our roads. So, how do you reach that population and direct them to the available resources?
Yeah, that's a great point, and I think, a lot of times what we think of as a homogeneous population of people is actually a very, diverse, heterogeneous population of people with very different pathways into homelessness, very different needs, and so one way that we do that is, we use data to help us identify folks really early in their, hospital course. And so that allows us to proactively identify people experiencing homelessness. To do that, we use Denver Health's homeless registry. And so that helps us, kind of more inclusively and comprehensively identify people who may be experiencing homelessness. And that's sort of our starting point. And then we use the Homeless Management Information System, or Colorado HMIS. And that really helps us better understand who this patient may be connected with in the community in terms of partners and resources. It helps us understand if they may be eligible for specific programs. And that is a good way to kind of see information that often hospitals are really blind to. Those data sources are really important for us to proactively identify folks and enable outreach to happen. And then we meet with the patient. So we have a consult based team. So an interdisciplinary team of social workers, care coordinators, myself, and others who are on the ground, who are really have a unique expertise and an understanding of the resources, which can often change. So they're not static. The team is really working closely on a day-to-day basis with a whole range of different community providers. When we're meeting with someone, we are really trying to meet them where they're at. We're really trying to understand what their unique story, what their specific barriers are. And we're really trying to make the best recommendation and connection for them based on not only their housing needs, but their health needs. And so we know that the patients that we care for in the hospital setting often have complex needs, such as functional impairments, mobility impairments, difficulties sometimes completing their activities of daily living, and that's about 60% of our patients on the inpatient side. And so these are folks with really complex needs. And so we're really trying to understand those specific barriers and what their preferences are, what their medical needs are, and make the best recommendation and connection for them in that moment. We're often seeing patients at their some of their worst moments, and it is a privilege to walk beside them, to sit with them in those worst moments, and to restore hope. So a lot of what I see as a hospitalist is loss of hope and what that can do to a person. And the last thing that people are expecting when they come to a hospital is a connection to housing or a partner, which ultimately could lead to more stability for them. That's often what they need most, because it's very hard to improve someone's health and well being when their basic needs are not met and they're focused on survival. So it feels really good to be able to provide something that is unexpected and that is hopeful, because I think that, myself as a physician who works in a hospital, I don't get to see the good outcomes. I see people during their worst times and times of crisis. And so to be able to provide these connections really helps us as healthcare providers, because witnessing the needless suffering that we see, especially in this group of patients that is preventable, it's hard. And it's really what I am passionate about. So I've seen sort of the use case. I've seen all the negative impacts of homelessness on folks' health, preventable loss of life, loss of limb, lots of complications. And I've also seen the reverse, that when we are able to restore hope, make a meaningful connection, and get someone to a place where they have more stability and their basic needs are met, it feels really good. And that's what really motivates me and drives me in my work.
It sounds immensely satisfying. I know there's no such thing as a foolproof system that's going to catch everybody and treat all of their needs, and but it sounds like you're covering as many bases as you possibly can, and that's just it's just so impressive. As we wrap up, I just wanted to ask, for anybody listening today who thinks, well, my hospital should be or could be doing something like that as well, what advice would you have? And I'm thinking more in terms of the financial burden on a safety net hospital and how much all of this kind of thing costs. Is it within the reach of hospitals of similar size or serving similar size metro areas or smaller markets for that matter?
Yeah, I mean, I think this is a great case of, not only is this the right thing, the best thing for my patients, but it also financially is the right thing as well. A good place to start is always going into community, being curious, not I think sometimes healthcare and hospitals go into community when there's a problem, when they want something, when they know how to fix it, and they want to tell people how to do that. And I don't think that that's the right approach to community engagement. I think going with an open mind and curiosity and learning and understanding. Sometimes there are resources that exist and we're just not aware of them. Other times, we have significant challenges with scarcity of supportive housing. And so those are significant challenges that we cannot solve within the hospital system. We cannot solve unless we come together as a community and think about this as an ecosystem where health systems can use our strengths, but we need partners. We can't solve all this on our own. But yeah, I think it's very important to think about our ability to provide care to people that need us. I think that looking at the financial benefits and the reduction in length of stay and uncompensated costs are important, as well as seeing how stable housing can provide it's really a platform for engagement in care, and ultimately is what's needed to improve, someone's health and well-being.
Well, I think the work that the Hope program is doing in Denver is, I already said this, but I'll say it again. It's inspiring, and I hope that people listening today will give some thought and think, maybe there's something we can learn from here. Maybe there's something in this model we can duplicate and do in our own backyard. And so I thank you for coming on Advancing Health today and for the fantastic work that you're doing on behalf of the people of Denver. So congratulations and keep it up.
Thank you very much.
Thanks for listening to Advancing Health. Please subscribe and rate us 5 stars on Apple Podcasts, Spotify, or wherever you get your podcasts.